Good evening, and welcome to this special mental health edition of Doctors on Call. I'm Mary Morehouse, a psychotherapist with Insight Counseling of Duluth, and I will be your host for our program tonight on addictions, alcohol, and drug abuse. This is our final mental health episode during this season of Doctors on Call. Our program is here to answer your questions about mental health issues that may affect your family or friends. Please call or email your questions, and we will do our best to address them. The telephone numbers and email address can be found at the bottom of your screen. Our expert guests this evening are Tanya Bednarek, a licensed alcohol and drug counselor with the Human Development Center in Duluth, and Jenny Rennqueist is a licensed alcohol and drug counselor and the administrator of care in Carlton, Minnesota. Our phone and email questions are being received this evening by members of the WDSE staff who will bring them to me here in the studio. Now, let's begin with a discussion of addictions, alcohol, and drug abuse. Thank you both for being here tonight. It's great to see you.
Thank you.
So I'd like just to start out with just getting a little bit of a background of in your field. So Tanya, if you could start, just give me a little bit of background in your field of addiction.
Yeah, addiction touches my life personally, but I've been in the field for 4 years.
Okay.
Yep. So it's a real passion of mine.
Okay, that's great. Jenny?
So I have been in the field for about 12 years. I started out at a local hospital doing consultations primarily on the inpatient adult psychiatric unit, but also throughout the whole medical hospital.
Okay.
And for the past 3 years now, I've been site administrator at Care Carlton, which is a state of Minnesota treatment facility for women.
Okay, great. Thank you so much. I think a good place to start is really what is the definition of addiction? So can you give us your definition or the definition that your agency uses for addiction?
Yeah. So the definition of addiction for us it's kind of broad.
Okay.
Addiction affects people in multiple different areas. For the program or the group that I'm leading, the women's group, Dr. Stephanie Covington, she has a definition that says addiction for women is the chronic neglect of self for someone else or something else. Okay. So that one I really resonate with because I work with women.
Okay, great. And what would your definition of addiction be?
Well, the first thing is that it's treatable. Okay. So it's it's a chronic problem, and some people say it's a chronic disease. Some people don't really resonate with that idea as much, but it's a chronic issue nonetheless. And when it crosses over into addiction, it's a compulsion, and it's operating in a part of the brain that doesn't think. Okay. So it's not a logic-based thing. You can't outsmart this thing, and it compels somebody to do behaviors despite negative consequences. So you're losing your family, your husband, wife might leave you, you might lose your job, you have embarrassment, humiliation, that kind of stuff, and you still are choosing to engage in that behavior, use that substance.
Okay. Okay.
And also it's very complex. It affects neural circuitry, neural pathways, and there's an interplay of life experiences, genetics, environmental factors, just very complex.
Okay.
And very often, it's stemming from trauma. There's a trauma history.
Okay. Okay, great. And just to note that we're talking specifically about drug and alcohol addictions tonight. We know that there are a lot of other addictions out there, but tonight, if we can get the questions just for the alcohol and drug for our listeners. So we've all been dealing with COVID for the last 2 years. How has COVID affected the way that you practice and work with people who are battling addiction?
Well, for us, we've had to move to telehealth services, and one of the biggest factors with treatment for substances is the group process. It's a really, really powerful process to be with a group and sharing their experiences. But with telehealth, it takes that away. Some people, it's found that it's been okay, it's been beneficial, but then other people have a really hard time with it. So we're still doing the very best we can to treat addiction, but it's definitely been an experience.
Yes, definitely. And what's been your experience with how the COVID has, on lots of different levels, has affected the treatment of addiction for you, or what you've seen?
A lot of different impacts. One, the big thing that stands out is the innovations and use of technology in the telehealth. So some things are working and some things are not really feeling great. So some of the telehealth group feels really disconnected, impersonal. It's really easy to tune out. You can't see everybody in the room from the screen a lot of the time. So it's not great. It's nice to use if you had to, if all of the facilitators, had to quarantine out of the building or something like that and could only tune in via screen, that might be helpful maybe. Being able to do comprehensive assessments, diagnostic assessments, those kind of things over the screen has been really helpful. That was a barrier in some cases in the past. It wasn't allowed, it wasn't billable. And so now that's been opened up, and I find that to be very, very helpful. Some of the things with COVID, just in the residential setting, some of the PPE, wearing the mask, has been a little bit of an issue, especially people who are older, hard of hearing, and people just being uncomfortable wearing the mask. The social distancing is kind of just a little bit frustrating, I think, for some clients, for some staff. We're all kind of used to it now. It's going on 2 years, but that's been a little bit of an issue. Also the sickness factor. When people are in a residential program, if somebody develops symptoms, they need to be quarantined into their room and stay in their room for, now it's 10 days, it was 14 days. So there's that isolation and just the practical issues with trying to keep somebody who's struggling with mental health, early recovery, in our case, civilly committed, they don't want to be there, and to keep them in the room. So things like that.
Yeah, and so you were talking about, connection and disconnection, and how a lot of times addiction is disconnection. Can you expand on that a little bit?
So addiction likes to hide in the darkness. It really, really grows and feeds in the darkness. And oftentimes what we see is people who do use substances and are addicted, they end up isolating themselves, and things kind of just get worse. With COVID, we've certainly seen people that are in long-term recovery. They have lapsed or relapsed, and are now coming in because they're struggling, and they lose their typical coping skills. They lose the connection with their families, with the community events that they used to do. Even the gyms were closed. So. It certainly has impacted. Isolation is a tough one.
So you said that people are now coming in. Was there a time that when this first started that nobody was able to kind of connect at all physically when it first started? Okay. Yeah. So there was a time that there was a complete disconnection. Yeah. And did you find that was a big hurdle to overcome?
Certainly.
Certainly, yeah. Yeah. And disconnection for you, and connection? Yeah.
So I'd say one of the biggest factors that leads to relapse, it's interesting you bring up that people who have been in long-term recovery, is stress. One of the biggest things is stress that's going to re-trigger, and a lot of people, they go to 12-step meetings, or they're meeting with therapy. They've got a lot of events to keep themselves coping with life, on life's terms, as they say, in recovery. And I would imagine losing that, then that's going to just wake that addiction mindset back up. And so connection, extremely important, and absolutely right, that shame and that addictive behavior hides in the dark and in isolation, and that we've created that artificially in our society for people. So prime breeding ground for relapse.
Yeah. And what about families? What can families do to help a loved one who is coping with addiction?
Well, I think the biggest thing is compassion. What I think a lot of people may not understand or realize is the person who's struggling with those substances have so much judgment and shame and guilt for being addicted, for the things that they do when they're addicted. And compassion is huge. And I think with society as well, we still there's still that moral failing belief, and it perpetuates, I think, that the addiction piece and the stigma.
Okay. And what can families do for you?
So I think that it's important that families and support people recognize that this is not just a one and done kind of thing. It's going to be in for the long haul. There's a decent chance a person may relapse. So I think it's really important that family members have their own personal boundaries and they keep them and not fall into enabling. A lot of people, I think, with a good heart, will enable people who are in addiction. They can be really crafty and savvy, and
that's the addiction speaking. It's not the person. It's the addiction.
Very much so.
Addiction is the sneaky one. The person isn't. It's the addiction speaking. It's not the person. And I think to kind of pull out the addiction from the person, it's a person with addiction. It's not. You know.
Absolutely. So having those good boundaries and upholding them, even you know, if you're going to stick with that person, you've got to uphold those boundaries with the person. And I would say getting your own support and your own help. There's some free services in town. Al-Anon is a good 12-step program, but also just psychotherapy, working with somebody to help to get your support while you are interacting with that person.
So the best support for the person, the loved one of someone who is dealing with addiction is helping themselves so they don't fall into the enabling trap, if you will. Yeah, okay, great. Okay, so here's a question from the Iron Range. How effective are the drug courts that people are required to go through, and what is the success rate? I don't know if either one of you.
I can't really speak to the statistics on the effectiveness, but with my personal experience, I have found that clients do benefit greatly from it. Okay. There's a lot of support. They have accountability. They have phases that they go through. So it can be up to 14-month long program. Okay. I hear good things from clients who go through those court systems. Okay.
Same here. I hear great things. I only would wish that it would be more of a long term, because what I hear is that people do it excellent while they're in that 14-month time period and then relapse soon after. And as we know, this is a lifelong journey that people are on. It doesn't just stop. But having that accountability, that lots of check-ins, lots of support, very, very beneficial for people. Okay. Yeah, I just think it needs to continue on, maybe at a lesser,
more graduated. Okay, sure. This is a question about can an alcoholic individual ever get to a point where they can drink in moderation? Would you like to take that, Jenny?
So there are some harm reduction models that have had some success. There's some medications too that people can take that, and I'm not a doctor, but I do know that I've heard anecdotally some people can take these medications that'll lessen the effect of the intoxication, and they've been able to drink normally. I'd say it's not an experiment somebody should do on themselves, and I would say that more often than not, if somebody truly is an alcoholic, no.
Okay.
Yeah,
I would agree with that.
Is that your agreement too?
Yeah, I would agree with that.
And so alcohol. So this was specifically, obviously, about alcohol. But what about other drugs, other substances? Would you say the same for those things too? No. Yes.
Yep.
Okay. I think though, if we think about opiates and methadone, Suboxone, MAT, medication-assisted treatment. That somebody is still continuing to use chemicals in a way, but they're living a healthier lifestyle, and they've got some accountability, and they know the drug that they're ingesting, and it's measured and things. So I think I would call that being able to function while still taking chemicals. So it's a little bit of a gray area almost.
Yeah.
And I do think that possibly people, I think that, say if somebody had an addiction to methamphetamines and it was severe, and then they used alcohol and didn't have a problem, I think that is possible, and that's just mine. I know there's a lot of controversy about that. They think, well, if you have that addictive personality, then you can't use any substances. But I have seen some kind of anecdotal evidence to say that some people could use other things in a normal way. Okay. What do you think about that?
Absolutely.
Have you seen that?
Absolutely. Yep. Everyone's journey with addiction, it is different, and people have their drug of choice, and it isn't uncommon to hear that, you know, my substance of choice is heroin, but I can have a drink every now and then, and it's not triggering for me. So that does happen.
Okay. Okay. Great. And there's a question. generally about parents and custody and addiction. So what sorts of experiences have you had with parents and custody and that addiction piece?
Well, I also work with the county. There's a program called North Star Families, and part of that is working with women who are pregnant or have recently had their baby, who struggle with addiction, and it's quite common to see CPS cases come in with that. It's complex. I think it's complex as well. There's so much to speak to that.
All right, so I have another question. Question from Hermantown. What kind of things do you discuss in the women's group? And I know you guys both, I know you both work with women, so I think you can both answer this, but I think you're specifically with the women's group that I should probably be referring to. Yeah.
So with the Helping Women Recover curriculum, it touches on 4 main areas that substance use affects for a woman. And so we talk about identity, their self. It touches on relationships, so relationships with others, relationships with mothers, fathers, being a mother, that sort of thing. It touches on sexuality, and it also touches on spirituality. So those 4 areas we talk about. But I think the key piece of it is the trauma. We also work with the trauma.
Okay, great. If you are concerned that a family member has a drinking problem, what is a good first step to address the problem? How can you get through to them without seeming judgmental? Want to take that, Jenny? It's a tough one.
It is a tough one. I would advise a family member not take that into their own hands by themselves. I would say consult with maybe an LADC, maybe call the county and ask for some assistance on it.
So that's a service that the county offers, is if somebody has a question about a loved one, and to find out whether or not, again, it rises to that level of addiction, which I think, which is why I kind of wanted to start the program with what is addiction. So to try and figure out whether that's true or not, that is a service that counties can offer. Okay, great.
Well, I mean, I wouldn't say that it's a service like that is labeled as something, but certainly you could call and speak with the substance use disorder social worker there, and kind of they could field some questions and kind of help navigate that a little bit. I think that if a family member is attempting to do some type of intervention with a loved one, that there's a good chance that it could backfire. The defenses are pretty strong around addiction, and the person might be open to it, but definitely I'd say get support. Get support first, talk to other people, talk to a professional, maybe talk to your doctor or their doctor about it first.
Okay. Is that what you
I would agree with that too.
First step, okay. And we talked about this a little bit before we came on. From Duluth, question from Duluth: can addiction, like alcohol addiction, be inherited?
So research does show that it is about 50% heritable. Yep.
So is that, and again, not to get into the weeds, like a family culture, like a genetic predisposition, or and then the culture of the family too, perhaps?
Certainly, yep. There's the genetic predisposition of a person, but addiction also it manifests as well from environmental. So the nature versus nurture piece. If there's substances within the home, it can travel down to other generations. So I mean, we see a lot of generational patterns with addiction.
The generational trauma.
Yep.
And then it comes out as addictions.
Yep.
Okay.
Yep.
Okay. Kind of going back to the women's group. So what sorts of things do you cover in your women's groups?
A wide variety of coping skills. So we use a lot of different modalities: DBT, CBT, motivational interviewing, EIMR, that's enhanced integrated mental health. It's just a really nice group facilitation covering just nursing, mental health, chemical dependency, all different topics, relapse prevention.
Okay.
A lot of what we do though is relapse prevention, coping skills, and trauma. not really going into like psychotherapy, trauma type stuff, but the issues that come out of it, and bringing the women to support each other.
Okay.
To talk about those things.
Okay.
Mm-hmm.
Okay. So what sorts of things? So we had a question about the first steps. What are some of the other, kind of like the bigger steps, or kind of some of the other, like a continuum of care, or like how the program would go in each, how long would the process be? Is it lifelong? Is it a 6-month, 12-month program?
Are you talking
for like addiction recovery? If somebody had a problem with addiction, they were referred to you. What would be a typical? What could people expect from like an HDC model?
Well, they could expect integration with family members is very, very likely. We totally lost my train of thought.
That's all right.
I'm sorry.
No, that's all right. We were asking about like what can people expect from a if somebody was referred to you for addiction, what would kind of the steps be? We kind of talked about like that first step, but what would like a time frame be? Is it like a weekly meetings, or is it group, or kind of?
Yep. So we have group 3 times a week. We're an intensive outpatient treatment program. So we have treatment Monday, Wednesdays, and Thursdays.
Okay.
Yep, for 3 hours at a time.
Okay. And how long does that?
Our program is kind of unique. We don't have a set time frame.
Okay.
And it's hard because in the past, programs have been like 96 hours for an intensive outpatient treatment program, or like 40 hours for just regular outpatient treatment. But because addiction is a lifelong process, and it's a lifelong something that they live with for lifelong, we find that the longer a person is in treatment, the better the outcomes, or the least likely they are to relapse, or the longer periods in between relapse as well. We've had clients that have gone through our program in 4 months, and we have clients that have been with us for a year, year and a half. So we don't have a set certain time.
Okay, great, thank you. All right, so is there a difference between men and women in terms of alcohol or drug abuse? And would you arrange or have addiction recovery differently between men and women? Again, in your experience.
So data from the Behavioral Health Division, Department of Human Services in Minnesota show that about 35% of admissions to treatment are women and 65% are men. So more men are going to treatment. As far as the services received, I think Tanya, because the Covington stuff, you might have a better kind of information about that.
Yeah, so we find that with women, there is definitely differences in why they use the process of addiction. It's more personal for women. It's more of a coping skill in terms of like child rearing, just everyday life. There is different processes, but also too how the effects of substances on a woman's body versus a man's body. Okay. So there are certainly differences. How women get into addiction, there's a lot of sexual abuse, a trauma history. That is definitely a big thing that we see.
Okay. Okay. And so are there men's groups available also in the Duluth area that are strictly men for alcohol and drug?
Not that I'm aware of.
That you're aware of? Okay.
Yeah.
I think Center for Alcohol and Drug Treatments, they separate out their houses by gender.
Yes. They're residential treatment.
Residential treatment. So some are that.
Yes.
Okay. So going a little bit back to kind of the processes that if people are kind of afraid or a little bit nervous to think that they might have a question, there's so much information out on Google. There's so much, when people have symptoms, they kind of go on the internet. What would you recommend as a first step for someone? So we talked about family members. What if you yourself think that you might have a problem? What would you recommend for a first step?
I would recommend that Doing the internet search can be helpful.
Mm-hmm.
You know, you can find good, reliable sources that can kind of help navigate whether or not you may have a problem or not.
Mm-hmm.
Otherwise, reaching out to professionals, I think, would be the biggest help.
Okay, reaching out to a professional, is that what you would recommend too?
Yeah, I think the state of Minnesota has done a lot starting in 2016-17 with substance use disorder reform policies, and they are now it's full on direct access. You can contact any treatment center and they are obligated to perform a screening or assessment right away, and you can choose. So it's really more person driven rather than it used to be an outside authority that would tell you, oh, here's what you're going to do, you're going to go to this program. And so just kind of looking up any of those numbers of treatment programs in your area and contacting somebody, and they can help you kind of tease that out a little bit with the screening process.
Wonderful, wonderful. Thank you both so much. I want to thank our panelists, Tanya Bednarek and Jenny Rennqueist, for their time and expertise tonight, and to the WDSE staff members for answering the phones, and for those of you who called in or emailed questions. This is our final mental health episode, but if you want to continue the conversation, attend the Let's Talk Minnesota Mental Health Action Concert featuring Cloud Cult, April 20th at the North Shore Theater. The concert will help raise awareness about mental health issues and features a resource fair with representatives from organizations providing mental health services. I'm Mary Morehouse for the guests and crew here at WDSE. Thank you for watching. Good night.